PCOS is a polycystic ovarian syndrome, what we call it as. There will be a complex of symptoms, signs and symptoms will be there. And 10% of the population will get affected, mainly the reproductive age group. People will be affected. I am Dr. SUMA VENUGOPAL, practicing in Bharat Nursing Home, Sadaki Gate, Kanapura Main Road, Bangalore, Karnataka. I am a gynecologist, consultant gynecologist in Bharat Nursing Home. Today I am going to discuss about polycystic ovarian syndrome, which is quite common, and treating my patients. Commonly, how the patients will present, what is the complications, which group of patients will be affected, I'll be discussing in this video. And PCOS is a polycystic ovarian syndrome, what we call it as. There will be a complex of symptoms, signs and symptoms will be there. And 10% of the population will get affected, mainly the reproductive age group. People will be affected. And it is quite common that patients, the sister, mother who has got a PCOS, they are quite common to get this PCOS syndrome. And PCOS is mainly diagnosed by at least two symptoms are there. One is irregular menses, and it may be obesity, and if there is any air distributions in the patients, those persons will be diagnosed as a polycystic ovarian disease. At least two symptoms should be there. And other thing, main common cause of this thing is, it is an hormonal variation which occurs. Common hormonal variations is, there will be increased level of luteinizing hormone will be there, and decreased level of follicular stimulating hormones will be there, and increase in insulin resistance. These are the hormones which causes, and also there will be increased androgen secretions. These are the hormones which causes all the variations and variations in the reproductive age group. Other thing is, commonly the patients who has what is the main complaints they come with is, they will have irregular periods, and they will have obesity will be there, and most of the patients come with that with primary infertility. They have not conception, and later they may have other complications. Complications will be discussed in the later stages. But what happens is, the main patients comes with the primary infertility. We have to treat them according to the patients, what is the age of the patient, and whether they want to conceive, whether they want to regularize the cycle, or what they are to see. Depending on that one, we will be giving the treatment for the patients. Main common increase, what all things happens, like pathogenesis. It may be because of there is a decrease in the follicular stimulating hormone. There will be so many follicles in the ovaries, and any one follicle will develop. For that one, it will be interrelated from the ovaries to the anterior pituitary, from where the follicular stimulating hormone will be released. But whenever there is a decreased level of the follicular stimulating hormone, it will not act on the ovary, and thereby there are so many follicles which it will be fail to mature and give ovulation. And thereby what happens is, there will be a small water filled follicles, cyst will be circulated. It will be just like a ring. It will be developed in the ovaries. That is one of the and there won't be ovulation, and the patient comes with infertility. And because of this increased FSH, decreased FSH, and there is no follicular, there will be luteinizing hormone will be increased in levels, and it causes irregularity in the menstruation. Thereby patients may have a postponed periods may be postponed, maybe 60 days, 90 days, or it may be around 120 days, depending on the hormonal levels, how it will recover. And another one is, insulin is the hormone which is presented by pancreas, secreted by pancreas. Because of this insulin resistance, and there will be an increase in the luteinizing hormones also. And because of this luteinizing hormone, again there may not be any maturation, will not be there, and period will be postponed. And insulin, and also there the increased secretion of the androgen hormones will be there, that is called the male hormones. And all these together causes these signs and symptoms of what is called as PCOS. And patient obesity will be there, and because of the increased androgen hormones, patients complaints with the excess hair, acne, all those symptoms will be there along with this patient. Because of this insulin resistance in the patient may develop diabetes or type 2 diabetes and all those things in the long term together. And whenever the patient comes with a history of PCOD, and if she is a very younger age group, then we have to, if she is obese, then we have to give the treatment according to that one. And if she is not married and she is not able to not come for the infertility, then we have to regularize her cycle. We have to tell her to go for dieting and exercise. Thereby, when she maintains that, when hormonal levels will become normal and she will have her regular cycles. When she is planning for the conception, and if she wants to conceive, in that case we have to go in, we have to induce the ovulation with ovulation induction drugs, and then thereby we have to regularize the cycles by giving hormones. And when we induce that one, FSH will be there, and to reduce the luteinizing hormone also we have to give the treatment, and thereby we can induction and we can do the fertility, we can give them for the conception. And if that these patients also will, when they conceive, there will be so many complications will be there. One such is infertility itself, and even if they conceive also, there will be chances of abortion is quite common. We have to take care of that one. And our second one is premature birth is also quite common with this PCOS patient. And third one is these patients can develop diabetes, gestational diabetes during the pregnancy. That's why prematurely we'll give the metformin tablets for the patients to not to develop diabetes during that time. And even prior to conception also we give metformin to reduce the insulin levels. Thereby we can maintain the patient can conceive. And then further case we have to be very careful during the pregnancy also. And even after that pregnancy and all, the patients post delivery also, long term period they go, they will have that type 2 diabetes will they get type 2 diabetes. And other thing is other cardiovascular diseases are quite common. And third one, patient may develop endometrial cancer, carcinoma and all those things. This is commonest with PCOD. And PCOD main treatment is, one is stress, diet, everything we have to follow up. And then depending on the patient condition, we have to treatment, it follows everything. For all the patient it is not the same treatment. And it depends on the age group, from 16 years to up to 35-40 years the patients will be affected. In those patients, how they come with the history and how they will be presented, depending on that one we have to treat the patients. And because the September month is the PCOS month, that's why we are presenting this one. And most of the population now is affected by this PCOS. And it is quite every alternate patients will have come with primary infertility. They will be having the PCOS. And the patient who comes with the history of irregular menses, in that one also every 1 in 5 patients will have a PCOS problems. And PCOS problems, it is complex syndrome, like it is not a disease because of multiple hormones affecting the organ. And you are going to have these symptoms and all those things. And it has to be treated, not only medications, and it is stress reduced, and patients diet, and even also to control the maintain the body, this thing according to the obesity and all, to do exercise, all those things. This is how the treatment modules. and it is not a single drug therapy or a one single time treatment. It can continue, and it is not that once we have taken the treatment our PCOS has gone. That is not the case with PCOS. It is a permanent one, and it has to be taken regularly by both. The patient has to take more serious than the doctors, and even whatever doctors advise, they have to take it, and accordingly they have to go through for this treatment PCOS.